Wonderful. So we're live?
Mm-hmm.
Hi everyone. This is Peggy Demetrio, nurse practitioner and owner of Qvita Health and Wellness. Thank you so much for joining us this morning for something fun, just to kind of get us away from the usual day-to-day stress that so many of us have been dealing with. I'm here with Ashley. She's our certified and medical esthetician, and Natasha, our medical assistant, who's been so kind to volunteer to be a model for this amazing treatment that we brought into the office. So we want to start by saying that we appreciate all of our patients, our clients, and it's been our pleasure to be here with you during this entire pandemic. Now that things are gradually getting back to what we're considering our new normal, we also want to introduce something more fun, something new. But I do want to tell everyone that we are continuing with pretty much all of the precautions we've been doing all along. We're disinfecting in between each appointment, but some of the things that we're doing differently is we're spacing all of our appointments out quite a bit more to allow for more time, less people in the building, more disinfecting. So you will see that. You may come in and say there's really no one else here, or maybe one other person in a different part of the building. That's something that we've been doing intentionally at least the past 6 weeks, and we're going to keep that up as well. We are wearing masks, and we ask that everyone come in wearing masks and not with additional family members. If you need somebody to drive you, let's say post a procedure, they can wait in the car, or if there's nobody else in our waiting room at the time, they can wait there. So we will inform you of different things that we've added, such as that, including temperature checks and things like that. But again, I will say most precautions we've always been doing. We're very well known for being a very clean office. We disinfect heavily anyways, but we've just stepped it up even more for your protection and for our protection. So all of you know, and we've gotten tons of calls wondering when we're going to be doing cosmetic procedures again. So we've been gradually easing into that this week. So we're excited to add something new. So there is an FDA-cleared device called Skinpen. So Skinpen is the only FDA-cleared microneedling pen. So, and let me say this, they are the first FDA-cleared. I think there may be a couple more now, so let me not say that they're the only one, but they're the first FDA-cleared microneedling pen. So why do we all need this in our life? Because we're all aging still, and according to all of my clients and calls I get, I'm getting complaints of our neck lines are more prominent, face is feeling looser and more saggy. We're noticing in our hands. This is a collagen issue. And just so you know, by the time you hit age 30, you're already losing collagen. And this has been measured in studies. You know, a baby may have 1.7 millimeters of collagen, or I should say of thickness of their dermis. Somebody age 40 is going to have half of that. Somebody age 60 to 70 is going to have just a fraction, almost just a sliver. So collagen is what gives us the firmness, the structure, which helps keep the lines from showing as much. So it's an important part of rejuvenation, regardless if you do Botox, Xeomin, fillers, regardless of everything else you do. If you don't have good skin health, everything else is never going to seem good enough. So this goes to a lot of my clients that they'll do their Botox and fillers on the regular, and they'll say, but this still bothers me, or you know, my skin is still loose, or my neck still bothers me. Exactly, it's because the collagen hasn't been addressed yet. So we do it in multiple ways. There are laser treatments for it. We do cosmetic threads, but microneedling, also known as collagen induction therapy, has been here for years, and it's not going anywhere. It's here to stay. It just keeps getting improved and revamped, and we've seen phenomenal results for that. So why Skinpen, right? Why are we making a big deal out of this? Why are we introducing Skinpen? Well, especially with all of the current issues and precautions going on, a lot of microneedling devices have been shown to cross-contaminate. So in other words, if you use it on one person, as sterile and careful as you are, a little bit of the fluid can go back into the pen and you think you clean it well, but then you do another treatment on the next person and you risk some cross-contamination. It has been seen in clinics throughout the country, throughout the world, some of them being closed down because of the infections that have been spread. So Skinpen has what they call a biosheath. Do you have it with you, Ashley? So can you see that, Ania? Mm-hmm. So there's a clear covering that she's already prepped onto the Skinpen. And it has a barrier also that protects the cartridge from having anything fall into the actual pen. And this is changed with each patient. Everything goes on in this package sterile, and there's absolutely no risk of cross-contamination. They've done over 90 studies on this device and checked for that.
Roxanne Markopoulos says hi.
Hey, Roseanne. Thanks for joining us. From Illinois, actually. So, love having people join us from other areas. So, anyways, yeah, cross-contamination, that's a huge thing. So, it was even more important to us to have some type of guarantee that that's not going to happen. Also, let people say, well, how do I know nothing's been reused? I have people sometimes, new patients that don't know us, they're like, well, how do I know this is getting used on one person?
So I can answer that. So
Awesome.
Each of them comes in a packet just like this. So I will always open up a fresh one right in front of you and attach it. So and it goes right into our sharps container.
And let's say she forgot and she tried to reattach the same cartridge on the same unit, it won't allow it, it locks out. Mm-hmm. So it has a lockout feature that you can't reuse it even if you wanted to. So it's a guarantee for you as well that that won't ever happen. But yes, Ashley will always open it in front of you. She'll show you it's a new cartridge. So no risk, no safety risk that way. Now, one of the other questions I get asked a lot is, but is it going to hurt? So with this system, we actually will put the numbing cream on for you. It comes with a 3-layer numbing cream, BLT. Those of you that have had procedures before have heard of BLT cream. So it's basically topical anesthetics. Ashley will apply that all over your face, and we will leave it sit for 15 minutes so it really gets in there and absorbs. Natasha has already had hers on. Because it's so thick, we had her do it and already wash it off, but we would do that for you just for the sake of time. We were doing that. So let's say we take care of your face. What other yes, question?
We have a question from Victorios Demetrio.
Oh, I know this one.
He says hi, and he says, what is the purpose of the head being stainless steel?
So, such a good technical question. So, they do come in different materials. Skinpen itself, all of the needles in the actual head, which there's 14 of them, are made of medical grade stainless steel. Because they are certified as medical grade, they are made to last longer without becoming dull. So why do you care if a needle is dull? Because it hurts. So if the needle is going in and out of your skin dull, you're going to have more pain, more discomfort, and it's just a bit sloppier as far as how we're making these little microchannels in your face and how it heals. Because even though we're doing all of these microchannels, we are doing it in a controlled way. So the trauma is controlled, the inflammation that occurs is controlled, and then as it heals, you get collagen formation. So by having those needles being medical grade, we can do a longer treatment, we can do more than one area, and we have better results. Another question?
Yes, so from Kathy Glanis, we have, how many treatments do most people need for the face and neck?
So, I mean, it depends on your age. We can't really answer that as a one answer, but somebody maybe in their 30s and 40s, assuming they don't have too much sun, 3 treatments is a great start, where you do 1 a month for 3 months. And it doesn't matter if it's your face or your neck. Sometimes it's the hands. Other times it's the abdomen. But depending, 3 treatments is a good start. If somebody has severe sun damage, let's say to the chest and the neck, they may need 6 treatments. They've been living on the lake their whole life, and they've got, the sunspots, the dark areas. They may need 6 treatments. In some surgical scars, for example, we had a lady who we love showing to our clients. We have actually only done 2 or 3 on her. I would have expected 6, but everyone heals different. She had a keloid type scar all over her arm, And even after her first treatment, we had a 50% reduction. But like I said, 3 is a good start, but with your consult, we can tell you how many you need. Another question?
Yep, so you did answer it. So from Renata James, she said, can it be used on scars and keloids?
Oh, well, sounds like I was talking about that. Yes, definitely. It's amazing for scars and keloids. By starting that process, that inflammatory process, and doing it as controlled as it is with the Skinpen, we have seen phenomenal results. The before and afters are great. We look forward to posting more of those, but yes, we can use it on those.
And another one. Any downtime?
Any downtime. So I'm going to say minimal downtime. So let's say I tried a treatment last week. What was it? Wednesday? I did a treatment last week, Wednesday. I'm going to post pictures soon just so you all can see the amount of redness, and you'll get to see it with Natasha as well. So you get a lot of redness that first day. So just plan on going home at that time, because you're going to have these little microchannels. Although all you see is redness, what we know is that you have open microchannels that stay that way for about 18 hours. So we prefer you're not exposed to a lot of elements, a lot of toxins that time. So it's great not to really do much that day and keep it clean. The second day, the redness is down, I would say, by 50%. But we still prefer you don't wear makeup. You can go out, you can do what you need to do, but it's going to be with sunscreen and no makeup. So however that works in your life. The next day after that, so let's say day 2, 3, pretty much normal. I went with no makeup for 3 days just because I wanted to see what the redness was like, but I had no redness by day 3. So I'm going to say very minimal downtime. It shouldn't get you in the way of anything, but just be aware of the redness and the need for sunscreen. And we have an amazing post-procedure kit that comes with most of our packages that will include all of that. Was there another question? Okay, good. Feel free to ask questions as we go along, because I'm not sure what everyone's thinking. I just know what we love about it. So we want to show you how this works, because it sounds great, but how does it actually work? So Natasha has never actually had microneedling done. So this would be like new client, little bit nervous.
Just a little bit.
Because she doesn't know what to expect. But we have control of the depth. So it's controllable in millimeters. So we know which parts of the face require a deeper treatment versus a less deep treatment. I mean, think about it. Your forehead is pretty thin. We don't need to go that deep there. But when we get to your cheeks, there's definitely a lot more tissue there. We're going to increase the millimeters there. So we are aware of how it needs to be in each area.
Thank you. What Fitzpatrick would you say she is?
So she's a tough one. What's that?
I said it's kind of weird.
Yeah, because she's both.
Yeah.
Right? It's almost like you're two Fitzpatrick. So Fitzpatrick means like, where are you on the scale of your skin color type? So Natasha genetically has these really actually pretty freckles, even though in our world freckles are skin damage. Because it's sun damage. It's just some people are genetically predisposed to more. So she's likely going to get lightening of these with her treatment. And any fine lines that she has, which her skin's in really good shape, but those are going to improve, and she's going to get thickening of the skin, because we want to thicken the top layer, the epidermis, and then the layer underneath the dermis. So like I said, did you prep her skin yet?
I wiped it down. I'm going to do some alcohol, and then I'm going to put some of the Glide, the EG.
Okay, perfect. So there's a lot of cleaning involved. I mean, besides the fact that she washed her face already, there's sterilizing any germs. We use HibaCleanse for that. Now she's doing a layer of alcohol. So we do several passes to make sure that everything is extra clean before she gets started. And it certainly doesn't go on with your skin dry. So in our Skinpen kits, there is a Glide that is used that has hyaluronic acid in it that just helps the device glide through nicely.
Alright, you just want to hold your breath for me for 2 seconds. Ready, 1, 2, 3.
While she's cleaning her face, a question I get sometimes is, well, why can't I do it at home? Why can't I just get one of those rollers? So I can talk about that all day, but the quick answer is the rollers do tear your skin, That's been proven repeatedly because as you're rolling it, it's pulling skin with it. They are not medical grade needles, so they don't go in and out quickly without the pull. You cannot control the depth. Although some people say, well, I can press harder and control the depth. Yeah, don't do that. There's a reason this is a medical procedure. So you shouldn't be putting holes, microchannels in your face at home.
Unless you're certified.
Unless you're certified. Yeah, and unless, again, I still would never do the roller in office. There's no comparison in the trauma and inflammation. Question?
Yep. So from Kathy Galana, she says, does it help wrinkles on the hands so she doesn't have to hide them under the table?
Oh, gosh. Well, you shouldn't need to hide them under the table anyways because your hands are your hands. But the hands are, as we all know, one of the giveaway areas for age. So many people are so careful and pay so much attention to their face, but they neglect their neck, the décolletage area, and the hands. So whether it be Skinpen Microneedling, laser treatments, we always do bring that up to all of our clients because especially I have clients that tell me they're in real estate or they're in some type of job sales where their hands show. Yes. So we're going to be doing packages as an introduction to the Skinpen. And one of the benefits will be we will be including a free extra area. So let's say you want to do this area, let's say your face and neck, but the hands bother you too, we'll include that too. The hands respond beautiful to microneedle. Yes.
And from Paulette Warrington.
Hey Paulette!
Hi. She said, will it get rid of smile lines?
So it depends on the depth of the smile lines. So if they're fine lines on the face, to me I take it to be these over here. Some people have them, some don't. If they're what we call rhytids, like they're thin little lines, it will reduce the depth. If they're really deep and thick, it'll still reduce it. It just you may just need more treatment. And it's an age thing. Somebody in their 30s and 40s will produce more collagen. Somebody a little older, it'll take longer for that. Did you get started? Yeah. Thank you, Paulette. So, she just started.
It's good.
How is it?
Doesn't hurt. Just a little uncomfortable, but not even that much.
Just like minor? So I think that area is the easiest. So a little bit. You feel it a little.
Yeah, it's not that bad.
Nice and pink.
So
Not
see
that
like
bad
her
at all.
skin color here? How it's kind of more that normal yellow tan, and then here she's turning red.
Yeah, right here in this area.
As you get closer to the nose, you feel it more.
Yeah.
But it's tolerable, right?
Yeah.
Considering what we're actually doing,
Doing a great job.
you would think it would be more painful, but it's not.
So we're just looking to get that nice, even pinkness. And she's already there,
I feel
really.
like certain areas bother a little bit more, but it's not really painful.
Awesome.
It's a little prickly.
So more prickling?
Yeah.
So on a scale of 1 to 10, 10 being like you can't
Or
stand
maybe
it? Yeah.
like not even a 3, maybe a 2.
Okay.
In certain areas, like you said, when it gets closer to the nose, it hurts a little bit more, but it's not unbearable.
Okay.
Yeah, it's not unbearable.
So it sounds like about a 2, and then when you get to more like thinner areas, it feels like a 3.
Yeah, it's not that bad.
Okay.
Question.
Sure.
From Renata James, she says, does it create a lot of inflammation?
So we are purposely creating some inflammation, yes, and that's going to be the first 72 hours mostly. Because your skin goes in phases. We like to think of it as 3 phases, but the first phase is going to be inflammation. But again, it's controlled. We're controlling this process. So we know when it's happening and when to expect it. But it's minor. Like right now, she's inflamed to her cheek because blood flow is going there. Inflammation is blood flow to a specific area, and that's your body's natural response. We want that because that triggers collagen production.
Another question from Carrie Eckhorn. Sorry if I
Sure.
said that wrong.
Hey, Carrie.
She says, how long does the redness last?
So as far as the redness,
2 or 3 days.
Yeah.
You weren't red that long.
and I get red really easy.
Yeah.
I wash my face and I get red. That's like the ongoing joke. But for sure, the first 2 days, for sure. Day 3, you're going to be like a mild pink, almost like sunburn level. After that, probably none. But again, this whole process of inducing collagen, it's about a 3-month process. So that's why we like to do one treatment every month for at least 3 months. And then by the time you're 6 months out, I mean, we have amazing results before and after. And then you want to maintain after that. Doesn't mean you're going to need a series of 3 again or a series of 6 depending on the level of damage that you have. But then you'll do like a treatment in 6 months. Because as long as you're aging, you're going to lose collagen. So we're trying to boost it and jumpstart it. And then after that, just kind of maintain in different ways so you can keep your results. And that's the secret for a lot of people's anti-aging. Question for me?
From Michelle Lakovic.
Hey, Michelle.
So she said, can this be done in conjunction with a chemical pill?
In conjunction, your poor face. It's tempting. It is tempting. But I probably wouldn't. Ashley?
I wouldn't.
Yeah.
I would do a series of this and then follow up with the peel for sure.
Not the same day.
Not the same day. I would do a series of this first.
Yeah. So the peel is great just to get that layer off, and you do get some collagen production with the peel, and you'll see like a lot of the sunspots and sun damage come off. I love using it even for my teens with acne. It just helps clear the pores. This is a bit deeper. We're going deeper than a peel.
Make it itch.
Yeah, I'm surprised you didn't sneeze yet.
I know.
So we're going like 1.5 millimeters on average, whereas the peel is just on the surface. So like Ashley said, like since any anti-aging procedure is a process, we would do something like this first, and then you don't need this for a while. Then we go, all right, what can we do in between to keep that skin and the skin cells turning over? A peel is great for that.
Yes. Another question from Heather Robinson. She said, after the
Heather.
first set of treatments,
Yes.
how often do you need to do the treatments again for maintenance?
So for maintenance, what I see for most people is one treatment about every 6 months. Now I have some people who like to mix it up, and I'm one of those people. I mean, I'm a huge microneedle fan, so I can probably tell you I do them quarterly. I do like a microneedle treatment quarterly. When I first started doing them, I did my series of 3 and then maintain quarterly. But I'm going to say most people probably do 1 in 6 months, and then just to keep the collagen there. If they're in the sun, like if you're someone that tells me, oh, in the summer I'm at the beach a lot, you're probably going to need something more often, whether it be a peel or a quarterly microneedle like I do. It just depends on your habits. If you smoke, which I know you don't, that's a whole other story. Then you just need something of some sort every month, because smoking just kills your collagen. So it depends on your lifestyle. Smoking, alcohol, lack of sleep, all of that reduces collagen. High sugar diet, processed foods. But on a normal level, I would say about every 6 months of treatment.
Sneeze spot.
Do we need to get this woman a tissue?
Yeah, that area, like even when you do like my filler there, I always want to sneeze. So I warned her beforehand. So I was just like, it's a little sneezy there.
Yeah, right around the nose. Like you said, whether it's Botox or filler, people get teary-eyed or sneezy.
Okay. Another question from Carrie Eckhorn. She said, can it be done with PRP?
Absolutely, yes.
So you're talking about one of our favorites here, and I haven't even gotten to that yet. So PRP is like the heal-all for so many things, and we use such a high-grade PRP system where we extract a good 800,000 to 1 million of your PRP cells. We've had phenomenal results with tendinitis, tendon tears, knee, arthritic conditions, shoulder problems, that we then incorporated that into our cosmetic side. And the healing, when you incorporate your platelet-rich plasma, you get quicker healing, more collagen induction, and this is what they call the vampire facial, that crazy video that was going around with the Kardashians with blood on their face. It's not bloody like that because PRP is gold. If it's done right, you really get straight up PRP, and you shouldn't be having blood cells floating around there. That's what we call the cheap test tube PRP. The legitimate high-end, high-result PRP is gold. So yes, we love doing that. It's one of our more popular anti-aging procedures. So yes, by all means.
Another question from Michelle Lakovic.
Yeah.
She said, what is Ashley putting on prior to the procedure?
Okay, so like the slide, so you're talking about like that kind of gooey stuff? Here, let me find it. So in all of the kits that come on our end, when we're putting this together, you don't want to rub the device dry. It's painful and you can risk some tearing. So there is a hyaluronic product called Skinfuse that we use, and our terminology is we call it the slide, but it basically just helps the skin pen glide across the skin. And this is after we've cleansed it, after she's been disinfected.
It's okay. Some people do. It's a natural body reaction.
Yeah.
I get you right, and Peggy.
Does it hurt more? Okay, that's what I was gonna say. So it's not that it's hurting.
No, it's not that it's hurting.
It's just the
like,
locations. Yeah.
Closer to the nose, it makes me
So you can tell, like, this area here, we can definitely go over it again because she's not as red.
Mm-hmm.
So we're gonna hit that area again. But however, everywhere else looks nice and pink, so it's perfect.
Yeah. And that's one good point about what you said, Ashley. So we call it the end point. We're trying to get it to a certain level of pink. That's how we know that we've given you a really good, effective treatment. With a lot of the other pens, it takes anywhere from 2 to 5 times as long to get to that. You're having to go over the area for a good hour before you can get to this. We can accomplish this usually in 15 minutes. So that's why we just put the numbing cream on you now for this, because we know that's 15 minutes. The treatment itself will take about 15. If we're doing multiple areas, maybe 20 to 30, depending. But in a fraction of the time, because of the science and the engineering of the device. That area is not bad, right? Good thing is she has thicker skin there.
She does.
So
I
that's
was
a
gonna
good thing.
say, a lot of people have more tissue on their cheekbones or cheek area than they do on their forehead always. So it's a little bit more comfortable.
Yeah.
Nice and pink.
Question from Nectarios. He
Yes,
said,
Nectarios.
for people that can't take pain, could they tolerate this? I have a friend. Smiley face.
I think I know who it is, someone you probably works with. So, I've never had somebody not be able to get through this treatment, ever. And I've never had somebody say, I need a break, it's too much. Never had that happen. I know some people don't tolerate pain as well. That's just a normal thing. Sometimes it's a genetic thing. But that's why the numbing cream is just not to that level.
It's not bad.
So it's not. She's rating it at a 2 to 3. She's never done
It's
it
not
before.
even,
I've told her to be honest. And then tomorrow when we also do this on Instagram Live, we're gonna have somebody else, so then we'll see what their pain level is as well.
But the worst part was just above the lip.
Above the lip?
Yeah.
And it's
That's
controllable.
what made you sneezy.
Yeah.
Yeah.
So let's say your friend was like, it's too painful for me because let's say they're sensitive. Like some people with certain medical conditions, let's say fibromyalgia, they have overactive pain areas on their body. So if somebody like that,
It's worse.
see if that was going to be worse.
Yeah.
So somebody like that, we would go, okay, let's just either adjust the level or we'll move it around more. Because even when I do more painful procedures, like all therapy is more uncomfortable, I find that moving the device around helps people tolerate it so we get through it. But this is nothing like all therapy. This is a walk in the park, not a big deal.
I thought it would be a little painful after, but you don't even feel like an after.
So
pain.
no after pain. Once it's done, it's done. I felt when I had it like a swelling feeling. Do you feel swollen?
Not yet.
Okay. That's good.
Question from Michelle again. She said, from a pain standpoint, how does this compare to Skin Tight? And I believe that is another brand of microneedle pen.
So the only skin tight word I'm aware of is laser. If it's a skin pen, I'm not familiar. If it's a microneedling device, collagen induction device, I'm not familiar with that brand. But microneedling, as far as pain level, basically the rule is the cleaner the needles, like for example, these are stainless steel medical grade, which means they're very sharp. So the sharper, the less pain. That's why rollers can be painful, because they're not as sharp and they pull your skin with each roll. So I don't know the technology of that, but I can look into it for you.
And Antoinette said, "Hi, hello, beautiful ladies." Hi, Antoinette.
Hey.
Michelle said, "Sorry, I mean the brow lift laser treatment she had."
Oh,
therapy.
okay. Yes. So, totally different feeling because the brow lift, I either do brow lift above the brow so we can get a lift here, and then sometimes I'll do it on the brow bone to give brow pump to give that brow a nice little lift. I'm going to say the laser is quicker because it's a small area because we're just trying to do the brow pop and the brow lift. But it feels deeper because it's causing the collagen induction underneath by going underneath because it's laser. So it's just different. Instead of kind of like a prickly, it feels more lasery, like hair removal-ish, except deeper. Also really tolerable because it's quick. But I'm just going to say different, like just different pain level. No one's told me it was too painful when I've done all the brow pops. I haven't really had any issue with that. If I'm going to say that there's laser pain, the most would be with all therapy when I'm doing people's lower face. But the results are so amazing, we just kind of grin and bear it, and I medicate people for that. And then we're good. But something like this or the brow lasers, we don't need medicine for that. It's not that level. Good question.
I have a question. So what's the post-procedure treatment that we would do?
Okay, yeah. So it's kind of pointless if we do this really high-end treatment for you and then you go home and don't have the right products. Because now that we've started this, like we've started this for Natasha, she's going to need to use specific treatments to give her the best results. I'm not saying she won't get results if she uses her Aveeno or whatever somebody else may be using. But if you're going to invest in something like this, you need something to accelerate your results. So get an A+ versus a B in results. So in all of the packages that we offer for the Skinpen, we have a Neo-Cutis post-procedure kit. So it has 4 pieces to it. And everything has antioxidants, growth factors. The morning piece has a sunscreen. You've got a hyaluronic acid component in that. So everything is developed to facilitate results for this. So it will come in a really nice bag, instructions, and everything you need to help facilitate the results. So there is a great post-procedure kit for this.
I kind of like to use the analogy, when you go to the dentist, you get a nice deep clean and everything's fresh and you feel good, but then you go home and don't floss or brush. It's the same thing when you don't use really good skincare.
It's so true.
You have to take care of your skin at home.
And ladies and gentlemen, like this is an investment. Like
Yes.
This isn't pocket change for most people. And we understand that and we get that. So if you're going to invest in these really effective procedures, medical grade, FDA-cleared procedures, you got to use good skincare. It's just part of the deal. It's anti-aging. You can't cut corners. What's that post that's been going around? You can't wear, what is it, like the shoe one? Something like you can't walk around with like, I don't know, like a Walmart wallet and then think you look like you're wearing Gucci or something like that. Yeah, like it all kind of goes together. It all goes together.
Another question from Paulette.
Yeah.
She said, "Can you compare the pain to laser?"
I'm going to say it's less than laser, Paulette. And it depends on the laser, but yeah, I'm thinking of the lasers like the 3 for Me, the IPL. To me, IPL is not bad at all. Either is Fraxel. Is it to any of the people that you laser?
No, they sit through it. They're fine. Yeah, they get there pretty well.
Yeah. I'm going to say, if I had to guess, I'm going to say it's less. But for me, having tried everything, it's similar, except it feels more pinchy, more prickly with the microneedle. Just because you're getting these very quick, oscillating needles in and out. They don't feel like needles, they feel prickly, but it's just different. Whereas the laser just feels, I don't know, it's like lasery. How would you describe the laser?
I would describe laser almost like as a rubber band snap, whereas this is more just like if you ever had a tattoo, but a lot less.
Yeah, way less.
Way less than a tattoo.
Way
So
less.
that just almost annoying little like prickly.
Yeah.
The laser almost feels like a rubber band snap.
Yeah, and so a lot of the principles are similar because the laser, depending on which one, we're doing what we need to do, just going directly under the skin. Like when I do all therapy, I also will do a 1.5 millimeter. But then I guess if I compare to that, I would say all therapy 1.5 millimeter depth is more painful than microneedling 1.5 millimeter
And
depth.
you have to remember, we don't let you go through this alone. We give you good numbing cream, so that
Yes.
way it's way more tolerable and more comfortable.
Yeah, I mean for sure. Because when I had tried it on my face, I tried an area with and without numbing cream.
She's crazy.
I just want to know what it feels like. And there was a significant difference. I can still do it without. Most of the time when I do microneedling or any laser, I don't use numbing cream. I just don't. I can get through it. It's fine. But it was nice to feel the difference with the numbing cream. So it does help quite a bit. Makes it very comfortable, like no big deal type of procedure. Any other questions for me? Anything else that you think of would be helpful for people?
No,
to know?
just make sure you're really cautious about after you get this done. Just make sure you want to spend some time in the house at home for the next couple of days.
Or even one day, I
Or
think.
even one day.
Yeah.
And then just making sure you're on top of your your post-procedure skincare routine, so that way we can get the best results.
Yeah. And like I said, we don't leave you hanging like that. That's included in the packages. As an intro, we're going to be offering packages with a varied amount of treatments. So call our office. Ashley's here. The other staff is here. All of our team would be happy to go over all of that with you. And then keep in mind, I know summer's coming, and sometimes people are like, well, I don't know if I can do this in the summer. That depends on your discipline. You know, I've seen some people like to tan. You're probably going to see me with a face shield this summer. So, yeah. So everyone's got a different level of tolerance. As long as you're wearing a hat and you're wearing sunscreen and you're trying to protect your skin, it doesn't matter. You can do it. It's not a problem. But if you're going to induce damage from the sun, like you're actually going to physically tan and not be careful about sunscreen, it's going to affect your results. And then I don't know if you want to do it during the summer. But the sun causes 80% of damage in general. So that's why I said you're going to see me probably wearing a face shield this summer. But just keep that in mind. Other things to know before your treatment: avoid anti-inflammatories, Advil, naproxen, anything like that for a good 3 days. You don't have to, it's just ideal to do that just for the whole immune response. We want your body to take blood flow and bring it to that area. So if you're taking Advil and naproxen, it delays that. So good to avoid those for 3 days. Avoid alcohol because it thins your blood and also gets in that way. Can't really think of any other medicines or other precautions right now.
What about retin-A's?
Oh yes, that's a big one. So retin-A, also known as tretinoin, even some of the cheaper brands where they'll call them retinols or retinoids, ideally a week. It's good to avoid those a week beforehand. And then we don't restart those until 2 weeks after the treatment. So give your skin the full 2 weeks. Like I'm 1 week out, so I'm not going to restart my tretinoin for another week because I use that about 3 times a week. So yep, that's another one. That's a good one.
I have a question.
Sure.
If I just had cheek filler, could I get this procedure done the next day?
I wouldn't, because we still have channels from the injection points that have not fully closed. So if I did cheek filler or really any other filler, I prefer to wait 2 weeks. I'm not saying you can't do it sooner, but if we're trying to be best practices and be safe, ideally 2 weeks. Yeah, that's a good time frame. Any other things you can think of?
No. How are you feeling right now? You're good.
You're still good? It's still not, because
I
now
feel
you're a
like
little
my
more
skin
red.
is- I feel like
Can
my
you see
skin
her
is
redness?
tight, but it's
That's
not. Yeah, that's a
perfectly
good thing, right?
normal.
Yeah.
So we're going to end up putting some post-procedure product on her face, and she's going to be red today and tomorrow. Yeah, but she can function normally. You'll have sunscreen on. Today we won't put any on, just avoid the sun. But as of tomorrow, sunscreen, and we'll be reviewing that kit for her.
Okay.
So we're going to be doing this on Instagram tomorrow. For those who morning doesn't work, we're going to be doing at 3 p.m. Eastern time tomorrow, and it's going to be on Instagram for those who follow that more. So even if you joined us today and you have more questions tomorrow, I mean, by all means, we'll be here. Our office is available to answer questions about any packages, and we're offering special pricing and intro packages until Friday and the business day. And again, we're back in business for all of our cosmetics. We've even added an extra Saturday this month, May 23rd, to accommodate everyone's schedule and allow us to just try and spread every appointment apart so we can keep things highest standard. Thank you so much for joining us. Have a wonderful day. Take care.
Bye.